Hello. So imagine that you've just gone on a trip. The holidays are coming up, so we'll say that you went and visited your family. Um, it's been about 8 to 10 days, and you're back, and you start to get a little bit of a fever. You have some weakness, some body aches, a headache, chills, and you kind of just brush it off because you just might be coming down with the flu. It's flu season, or you're getting a cold. But now symptoms are getting worse as time goes by. Now you have vomiting, nausea, diarrhea, you got bloodshot eyes, you have a red rash, and now you're bleeding. You notice blood in your vomit and your stools. You bleed really easily, you bruise really easily, and you feel so tired. Your fever hasn't gone away. You're in so much pain. You really need to get medical attention, but you have no idea what's going on, how you even got it, or how they're even going to treat it. Ebola is now in the United States. According to the World Health Organization, it has a 50% fatality rate. It is easily transmitted, and everyone needs the help in the community to help keep this in bay. When I was 17 years old, I read the book called The Hot Zone by Richard Preston. It is about the first case of Ebola in Africa, and about a case of Ebola that came in monkeys, because that's where it began, and that came to America. I'm also a registered nurse. Since the Ebola outbreak, I've been through training with Ebola. We've studied new protocols that we've had to go over, and also I'm used to taking care of patients with infectious diseases. Currently making its way into America, Ebola is deadly, but it is also containable that has affected the lives of thousands. So we need to know the symptoms, how it is treated, and how you can protect yourself. If one becomes infected with Ebola through bodily fluids, your symptoms will start to appear. According to the Centers of Disease Control and Prevention, symptoms of Ebola can be dormant for 21 days, but it usually takes about 8 to 10 days after contact for symptoms to appear. Ebola can be hard to notice at first because the symptoms of it appear so much like other viruses such as malaria and meningitis, and also the big one is the flu, since it's flu season now, according to the World Health Organization. The first symptoms from the CDC are a low-grade fever, body aches, headache, chills, and weakness. That sounds a lot like flu symptoms. But as time goes on, the symptoms that are more trademark to Ebola will start to come off. They will be the nausea, the vomiting, the diarrhea, the bloodshot eyes, the red rash, the fever will not go away. Your body aches will get worse. And as it goes on, from the Mayo Clinic, that they will get worse. Ebola kind of liquefies your organs. You just bleed from everywhere. Preston, in his book, noted that it was like whenever they did autopsies, that the liver and organs were like cadavers, that people have already been dead for days. So it really does work on your body. There is no vaccine, there is no cure. So as soon as symptoms appear, we need to try and make sure that we start getting treatment. Since I said there is no vaccine, there is no cure, but there are two potential vaccines being tested right now that are kind of working with, and they're showing potential. As soon as you show symptoms, get to the hospital and get treated ASAP. There are tests available that we can rule out Ebola if we need to. So the first thing that we do, according to the CDC, the only treatments that we have are treating the symptoms. So we will give you IV fluids. We will replace your electrolytes. We'll keep your oxygen up, and we'll keep your blood pressure up. Those are the main things that we can do. All we can do is treat the symptoms because we don't have a cure. From the National Institute of Health, they are showing promises in the past and right now with blood transfusions from Ebola survivors. Whenever Ebola is in your body, it comes up as an antigen in your blood. So whenever you've had Ebola, you have antibodies against that antigen that fought against Ebola. So we're giving blood transfusions to patients who currently have Ebola from past survivors, and it has been showing great progress and great success with those. So since Ebola is highly contagious, and it's treatable, but there's no cure. We need to make sure that we are preventing ourselves. It is possible. So with every kind of disease, Ebola included, prevention and control are the best treatments. The first thing from the World Health Organization in treatment and prevention is hand washing. I know a lot of people ground that in, but hand washing is so important. You don't think about it after you go touch something, then you go touch your face, your nose, your mouth, and then you have the virus. So make sure that you wash your hands with warm water and soap often. Ebola is transmitted through bodily fluids, so to protect ourselves, if anyone has this illness, try and stay away from them. Don't touch them. Make sure that you don't, if they sneeze, stay away from them. If they're talking, spit does come out, so make sure you're protected yourself. If you have to go around anyone who is infected with Ebola, make sure that you are in approved CDC protection outfits. And honestly, just try and stay away from it if you possibly can. And as a nurse, I just want to point out that public places, people aren't contagious until they're symptomatic. But remember that the early symptoms mimic the flu. So, people spit when they talk. They touch their mouth, their nose, and then they touch the shopping cart at Walmart. Or they go pump gas and now it's on the gas handle. So make sure that you try and utilize resources. Walmart offers sanitizing wipes for your carts. I keep the hand sanitizer in my car, so after I go pump gas, I can put hand sanitizer on. It's disgusting to think about the people that touch those things. So these are things that we can do to protect ourselves. Staying educated and knowing what to do can really help you feel better. Don't listen to what everyone says on Facebook. Make sure you know the facts, and that will help keep you calm in this whole Ebola blow-up. Ebola is a virus that can be fatal, so we need to make sure that we know the symptoms, the treatments, and how to protect ourselves. It is currently making its way into America. Ebola is deadly, but is a containable virus that has affected the lives of thousands. Ebola is more popular now than it's ever been because it's now affecting the people in our country. We have the 2 potential vaccines, so hopefully we get a cure and the vaccines come out soon so that we can get rid of this awful virus. So I hope you guys learned something about Ebola that will help calm your fears, and thank you so much.